What if one of the most dangerous things for your blood pressure is not hiding in your kitchen, but sitting quietly inside your medicine cabinet? It may be a tablet you take when your nose feels blocked. It may be a pain reliever you use whenever your knees begin to ache. Or it may be a product that promises more energy, faster weight loss, or the strength you had 20 years ago. Most people assume that if a medicine can be purchased without a prescription, it must be harmless. But after the age of 60, that assumption can become a serious mistake. I'm Dr. James Carter, and today I want to show you 6 categories of medicines and supplements that deserve much more attention than they usually receive. These products are not automatically dangerous. Many of them are useful, and some can be essential when prescribed for the right reason. The real problem begins when they are taken by the wrong person, combined with other products used at the wrong dose, or continued far longer than necessary. As we grow older, our bodies may process medicines differently. Kidney function can change. The liver may clear certain substances more slowly. Blood vessels may become less flexible, and many adults are already taking medicines for blood pressure, diabetes, heart disease, arthritis, or sleep. That means a simple over-the-counter product can sometimes interfere with a treatment plan that was previously working well. Stay with me, because number 4 is a medicine many people describe as a stomach protector. Number 2 is often promoted as a way to feel younger. And the number 1 category may be hiding inside a product labeled natural. Let's begin with number 6, decongestants. Imagine that you wake up with a cold. Your nose is completely blocked, your head feels heavy, and breathing comfortably seems almost impossible. You take a cold and flu tablet. Within a short time, the pressure improves, and your nose begins to open. The relief can feel almost immediate, but have you ever stopped to ask how that happened? Many decongestants reduce nasal swelling by narrowing blood vessels in the tissues inside the nose. That can create more space for air to pass through. The difficulty is that this effect may not always remain limited to the nose. In some people, decongestants can raise blood pressure, accelerate the heart rate, produce palpitations, or create a feeling of nervousness and restlessness. For a healthy younger adult, a brief change may not cause a noticeable problem. But the situation can be different for someone over 60 who already has uncontrolled hypertension, an irregular heartbeat, narrowed arteries, or a history of heart disease. Another issue is that decongestants are often hidden inside combination products. One box may say cold and flu, another may say sinus relief, a third may promise daytime congestion control. The names appear different, but they may contain the same active ingredient. A person can take 2 products on the same day without realizing that the doses are being added together. That is why the front of the package is not enough. You need to read the section labeled active ingredients. Oral products containing pseudoephedrine or phenylephrine deserve particular attention. In recent years, the effectiveness of oral phenylephrine for nasal congestion has been questioned by the United States Food and Drug Administration. That creates an important concern. Some people may be accepting cardiovascular side effects for a treatment that may provide little meaningful benefit. This does not mean you should panic or throw every cold medicine away. It means that if you have high blood pressure, heart disease, glaucoma, prostate problems, or take several medications, you should ask a doctor or pharmacist before choosing a decongestant. Depending on the cause of the congestion, saline rinses, saline sprays, warm steam, adequate hydration, or a humidifier may offer relief without the same stimulant effect. An allergy treatment may also be appropriate, but only when allergies are actually the cause. The safest question is not simply, will this open my nose? The better question is this safe with my blood pressure, my heart condition, and the other medicines I already take? And if decongestants surprise you, the next category deserves even more attention. Because most people do not take it for a cold. They take it every time something hurts. Number 5 on our list is a group of medicines known as non-steroidal anti-inflammatory drugs, often shortened to NSAIDs. Common examples include ibuprofen, naproxen, diclofenac, and ketorolac. You may have taken one after waking up with a painful back. Perhaps you used one because your knee hurt while walking downstairs. Maybe it was a headache, a swollen joint, or shoulder pain that kept you awake. And in many cases, the medicine worked. Within an hour, the pain became quieter. You moved more comfortably, and the rest of your day felt manageable again. That immediate relief is exactly why these medicines can slowly become a routine. At first, you take one occasionally. Then the pain returns, so you take another. Before long, the pattern becomes automatic. Pain appears. A pill follows. The important issue is not usually one correctly dosed tablet taken on a rare occasion. The greater concern is repeated use, especially when someone begins taking these medicines several days a week without medical supervision. NSAIDs reduce pain and inflammation by affecting substances in the body called prostaglandins. But prostaglandins are involved in more than pain. They also help regulate blood flow to the kidneys and influence how the body manages salt and fluid. When that system is disrupted, some people begin retaining more sodium and water. More fluid in the circulation can make blood pressure harder to control. It may also place additional stress on the heart, particularly in someone who already has heart failure or weakened kidney function. These medicines can also interfere with the effectiveness of certain blood pressure treatments. A patient may continue taking the same prescription every day, yet suddenly notice that the numbers on the monitor are higher than usual. The blood pressure medicine may not have stopped working. Another product may be working against it. NSAIDs have also been associated with an increased risk of heart attack, heart failure, and stroke. That risk is influenced by the specific medicine, the dose, the duration of use, and the person's underlying health. This is why two people can take the same pain reliever and face very different levels of risk. A healthy person using a low dose for a short period after a minor injury is not in the same situation as a 70-year-old with hypertension, kidney disease, and a previous heart attack who takes the medicine every morning. There is another important distinction involving aspirin. Low-dose aspirin may be prescribed to certain patients who have already experienced a heart attack, stroke, or another condition involving blood clots. In those situations, it may help prevent another serious event. But aspirin is not something everyone should begin taking on their own. It can increase the risk of bleeding, interact with other medicines, and may provide no benefit to someone who does not have a clear medical indication. If a cardiologist has prescribed aspirin, do not stop it because of this video. And if you are not taking it, do not begin simply because someone told you it protects the heart. The decision must be based on your individual risk. So, how can you tell whether your painkiller use has become a concern? Begin by counting how many days you used it during the last month. Not how many tablets are currently left in the box. Not how often you believe you take it. Write down the actual number of days. If you discover that you are using an anti-inflammatory medicine several times each week, that is worth discussing with your doctor. The next step is to investigate why the pain keeps returning. Persistent joint or back pain should not automatically lead to an endless cycle of tablets. Depending on the cause, treatment may involve physical therapy, carefully selected exercise, changes in daily movement, weight management, topical treatments, or another medication that is more appropriate for your medical history. You may also need your blood pressure and kidney function checked, especially if you have been using NSAIDs regularly. The goal is not to force you to live with pain. The goal is to control the pain without quietly creating a second problem in your heart, blood pressure, stomach, or kidneys. And now we come to number 4. This next medicine is very different from a painkiller. Millions of people take it because they believe it is protecting their stomach. Some were told to use it for 2 weeks. Yet years later, they are still taking it every morning without ever asking whether they still need it. Number 4 on our list surprises many of my patients because they don't think of it as a medicine that deserves a second thought. They think of it as protection. Protection for the stomach, protection against acid, protection against ulcers. And when something is described as protective, it's easy to assume that taking it longer must be even better. Unfortunately, that isn't always true. I'm talking about medications known as proton pump inhibitors, or PPIs. Common examples include omeprazole, pantoprazole, esomeprazole, and lansoprazole. These medicines have changed millions of lives for the better. If someone has severe acid reflux, stomach ulcers, bleeding in the digestive tract, or needs stomach protection while taking certain medications, a PPI can be incredibly valuable. The problem is not that these medicines exist. The problem is that many people continue taking them long after the original reason has disappeared. Let me give you an example. A fictional patient I'll call Robert developed severe heartburn after taking anti-inflammatory pain medicine for several weeks. His doctor prescribed omeprazole for 1 month while the irritation healed. The treatment worked exactly as planned. His symptoms improved. But 6 years later, Robert was still taking the same pill every single morning. No one had ever asked if he still needed it. And he had never thought to ask. That situation is much more common than people realize. Many older adults continue refilling these prescriptions simply because they've become part of the morning routine. Coffee, blood pressure medication, vitamin, omeprazole, day after day, year after year, without another conversation. Now, to be clear, some people truly do require long-term acid suppression. Certain medical conditions absolutely justify ongoing treatment. But continuing a medicine indefinitely should always be a conscious decision, not an accident. One reason doctors periodically review these medicines is because stomach acid actually performs several important jobs. It helps release certain nutrients from food. It contributes to normal digestion, and it plays a role in limiting harmful bacteria entering the digestive tract. When stomach acid is suppressed for a prolonged period, those normal processes may change. One nutrient that deserves particular attention is vitamin B12. Over time, some people taking long-term PPs may absorb less of this vitamin. The deficiency doesn't happen overnight. It develops slowly, sometimes so slowly that people blame the symptoms on aging itself. They feel tired. They notice less energy. Walking feels more exhausting than before. Their hands or feet occasionally tingle. Some develop memory problems or difficulty concentrating. Others become anemic without realizing why. Of course, these symptoms can have many different causes. Low vitamin B12 is only one possibility. But it is an important possibility that should not be overlooked in someone taking acid-reducing medication for many months or years. Researchers have also explored possible links between prolonged PPI use and cardiovascular disease. The evidence is still evolving, and scientists continue debating whether the medicines themselves are responsible or whether other health conditions explain the association. That's why it's important not to jump to conclusions. Instead of asking, "Is this medicine dangerous?" ask a better question. "Do I still need this medicine today?" That's a conversation worth having. If your physician believes the benefits still outweigh the risks, then continuing treatment may be exactly the right decision. But if the original problem has resolved, your doctor may decide to reduce the dose, use it only when necessary, or gradually discontinue it. Notice I said gradually. Stopping certain acid-suppressing medicines suddenly may cause rebound acid production, making symptoms temporarily feel worse. That is another reason not to make changes on your own. If you've been taking one of these medicines for a long time, ask your healthcare provider 4 simple questions. Do I still need it? Am I taking the lowest effective dose? Should my vitamin B12 or magnesium levels be checked? And is there another way to control my symptoms? Sometimes those 4 questions can prevent years of unnecessary medication. Now let's move to number 3. This next medicine often produces the fastest relief on today's list. In fact, many patients describe it as almost miraculous. And that's exactly why it deserves careful respect. Number 3 is corticosteroids, prednisone, dexamethasone, methylprednisolone, steroid injections. Few medicines can reduce inflammation as dramatically as these. A person struggling to stand because of severe back pain may feel noticeably better within a day or two. Someone with a painful arthritis flare may suddenly move much more comfortably. Breathing may improve during a severe asthma attack. Swelling may rapidly decrease. When a medicine works this well, it's understandable why people begin trusting it. Some even ask their doctors for another prescription because they remember how quickly it helped the last time. But every powerful medicine comes with trade-offs. Corticosteroids influence nearly every major system in the body. One of their effects is encouraging the body to retain sodium. And where sodium goes, water usually follows. Extra fluid means the heart has more work to do. Blood pressure may begin climbing. People who previously had well-controlled hypertension sometimes notice higher readings after starting steroid treatment. Another important effect involves blood sugar. Even people who have never been diagnosed with diabetes can experience temporary elevations while taking higher doses. For those who already have diabetes, glucose may become much more difficult to manage. Some patients require temporary adjustments to their diabetes medications until the steroid treatment ends. Corticosteroids may also affect cholesterol levels, body fat distribution, muscle strength, bone health, and immune function when used repeatedly or for long periods. That's a long list. But here's something extremely important. Hearing about these risks should never make you afraid of appropriate treatment. Let's imagine another fictional patient. Margaret is 71 years old. She has severe rheumatoid arthritis. Without corticosteroids during disease flare-ups, she struggles to dress herself, prepare meals, or even walk comfortably around her home. For Margaret, avoiding steroids altogether could actually cause greater harm. Her physician carefully monitors her blood pressure, blood sugar, bone density, and treatment schedule. That's responsible medical care. The danger appears when steroids become the answer to every ache and pain without anyone stepping back to ask why the pain keeps returning. Some people receive repeated injections several times a year without reviewing the bigger picture. Others borrow leftover tablets from family members because they remember how effective they were before. Those situations deserve caution. The goal should never be chasing temporary relief while ignoring long-term consequences. Another misunderstanding involves steroid injections. Many people believe that because the medicine is injected into one joint, the rest of the body never notices. In reality, depending on the medication, dose, and individual patient, part of that steroid can still be absorbed into the bloodstream and produce effects beyond the injection site. That doesn't mean every injection is unsafe. It simply means injections should be viewed as medical treatments, not routine maintenance. If you require corticosteroids for asthma, autoimmune disease, inflammatory bowel disease, severe allergies, or another serious medical condition, continue working closely with your physician. Never stop long-term steroids suddenly without medical guidance. Your body gradually adjusts to these medicines, and stopping them abruptly can create serious complications. Instead, ask practical questions. How long will I need this treatment? Will my blood pressure or blood sugar need monitoring? Are there lifestyle changes or other therapies that might reduce my need for future steroid courses? Those conversations often improve long-term outcomes far more than simply requesting another prescription. Now, we've reached number 2. This next treatment has become increasingly popular because it promises something many people desperately want: more strength, more energy, more confidence, and perhaps the feeling of being young again. We've reached number 2 on our list. Unlike the medicines we've already discussed, this treatment is rarely taken because of a cold, heartburn, or joint pain. It's taken because people want something almost everyone desires as they grow older: more energy, more strength, more motivation, a better sex drive, the feeling that aging has somehow slowed down. I'm talking about testosterone therapy. Over the last several years, advertisements for testosterone have become increasingly common. Some promise renewed vitality. Others suggest that feeling tired, losing muscle, or having less interest in sex automatically means your testosterone is too low. But growing older and having low testosterone are not the same thing. Many factors can contribute to fatigue: poor sleep, depression, certain medications, thyroid disorders, poor nutrition, chronic stress, heart disease, even untreated sleep apnea. If every tired 65-year-old automatically needed testosterone, nearly everyone would qualify. Fortunately, medicine is far more careful than that. Proper testosterone therapy begins with a detailed evaluation. Doctors don't diagnose testosterone deficiency based on a television commercial or a single symptom. They consider your medical history, perform a physical examination, and confirm persistently low testosterone levels with appropriate blood testing, often repeated on separate mornings because hormone levels naturally fluctuate throughout the day. When someone truly has testosterone deficiency, carefully monitored treatment can improve quality of life. That is an important point. This video is not saying testosterone is bad. For the right patient, under proper medical supervision, it can be an effective and appropriate treatment. The concern begins when testosterone is treated like an anti-aging shortcut rather than a prescription medication. Let's imagine another fictional patient. David is 66 years old. Over the past year, he noticed that he became tired more easily during afternoon walks. He gained a little weight around his waist and didn't recover from exercise as quickly as he used to. He saw an online advertisement promising to restore youthful energy. Within a short consultation, he received testosterone therapy without anyone thoroughly investigating why he felt fatigued in the first place. Months later, David certainly felt stronger. He also developed higher blood pressure than usual. Routine blood work showed that his red blood cell count had increased significantly. Why does that matter? Because testosterone can stimulate the body to produce more red blood cells. To a certain point, that's completely normal, but if the blood becomes too concentrated, it may place additional stress on the cardiovascular system and increase the possibility of clotting complications in certain individuals. That is why physicians regularly monitor hematocrit and hemoglobin during testosterone treatment. Monitoring isn't an optional extra. It's part of safe therapy. Researchers have spent years studying whether testosterone therapy affects the risk of heart attacks and strokes. The results have not always been consistent. Some earlier studies raised concerns about cardiovascular events in certain groups of patients. More recent research has provided a more complex picture, suggesting that carefully selected patients receiving appropriate treatment under medical supervision may not face the same level of risk that was once feared. What does that mean for you? It means there is no simple answer. Testosterone is neither a miracle treatment nor a medication that should automatically be avoided. The right decision depends on the individual sitting in front of the physician. That's why online advice can never replace a proper evaluation. If someone offers testosterone after only a brief conversation without reviewing your medical history, discussing possible risks, or arranging follow-up blood tests, that should raise an important question. Safe medicine is never just about writing a prescription. It's about monitoring what happens afterward. If you're currently receiving testosterone therapy, ask your doctor several practical questions. How often should my blood work be checked? Are my red blood cell levels changing? Is my blood pressure remaining stable? How is my prostate health being monitored? And most importantly, are the benefits I'm experiencing still outweighing the risks? Those questions help transform treatment into responsible care. Because the goal is never to chase youth at any cost. The goal is to protect your health while maintaining the highest possible quality of life. Now we arrive at the final category. Ironically, many people don't even realize they're taking it, because it isn't always sold as a medicine. Sometimes it's sold as energy, sometimes as motivation, sometimes as rapid weight loss, and sometimes as something completely natural. Number 1 on today's list includes stimulants. That category is much broader than many people realize. It can include prescription stimulant medications used for certain medical conditions. It can include highly caffeinated energy products, pre-workout powders, weight loss supplements, energy capsules, certain cold medications, and products purchased online with ingredient lists that are incomplete or sometimes completely inaccurate. Many of these products are marketed using words people naturally trust: natural, clean, herbal, metabolism support, healthy energy. Unfortunately, those descriptions tell us very little about how the product actually affects the body. The heart doesn't respond to advertising. It responds to chemistry. Most stimulants work by increasing activity within the nervous system. As a result, heart rate may increase. Blood pressure may rise. The body releases more stress hormones. Some people become more alert. Others feel anxious. Some notice shaking hands. Others experience difficulty sleeping for hours after taking the product. For someone with an otherwise healthy cardiovascular system, those effects may be temporary. But imagine someone who is 70 years old, already has hypertension, drinks several cups of coffee every morning, and decides to add a concentrated pre-workout supplement before exercising. Their heart isn't responding to just one stimulant anymore. It's responding to all of them combined. That's one reason healthcare providers always ask patients about supplements in addition to prescription medications. Many people answer, "I'm not taking anything." What they actually mean is, "I'm not taking prescription medicine." Then they mention an energy drink, a fat burner, 2 herbal capsules, a performance powder, and several cups of coffee every day. Those products matter. They all count. Another concern involves products marketed for rapid weight loss. Some contain stimulant ingredients designed to suppress appetite or increase energy expenditure. Others rely on large amounts of caffeine or compounds with similar effects. The number on the scale may fall quickly, but losing water is not the same as losing body fat. Temporary dehydration can place additional strain on the kidneys, affect blood pressure, and make the cardiovascular system work harder than necessary. There is also another issue that deserves attention. Unlike prescription medications, dietary supplements are not evaluated before they reach the market in the same way prescription drugs are. Independent testing has occasionally found products containing ingredients that were never listed on the label or concentrations that differed significantly from what consumers expected. That uncertainty creates another layer of risk. The safest approach is to treat every supplement with the same respect you would give a prescription medication. Know exactly what you're taking. Know why you're taking it. Know how it may interact with your existing medications. And never assume that natural automatically means safe. As we've gone through these 6 categories today, you may have noticed something important. None of these products are automatically good or automatically bad. Every one of them has helped patients. Every one of them has also created problems when used incorrectly. The difference is rarely the bottle itself. The difference is whether the treatment matches the individual. In the final part of this video, I'm going to show you a simple 5-minute medication review that every adult over 60 should perform at home. It could help you identify unnecessary medicines, dangerous combinations, and the questions that every patient should ask before starting or continuing long-term treatment. If you've stayed with me until now, you've probably noticed something important. This conversation was never really about making you afraid of medication. It was about helping you become a safer, more informed patient. Modern medicine has saved countless lives. Blood pressure medications have prevented strokes. Antibiotics have treated life-threatening infections. Insulin has transformed diabetes care. Heart medications allow millions of people to live longer than ever before. The purpose of today's discussion is not to convince you that medicines are dangerous. The purpose is to remind you that every medicine deserves a reason, a plan, and regular review. As we get older, our health changes. Our kidneys may not process medicines the same way they did 20 years ago. Our liver may become less efficient at breaking down certain drugs. We may develop new medical conditions. And perhaps most importantly, many of us begin taking several medications at the same time. A treatment that made perfect sense 5 years ago may no longer be the best choice today. That is why medication reviews become increasingly valuable with age. So I'd like to leave you with a simple exercise that takes only a few minutes, but can lead to an incredibly important conversation with your healthcare provider. Choose one afternoon this week, open your medicine cabinet, then gather everything you currently take. Not only your prescription medications, bring out your vitamins, your herbal supplements, your sleep aids, your pain relievers, your cold medicines, your allergy products, your energy drinks, your weight loss supplements, everything. Many people are surprised by how many bottles end up on the kitchen table. Next, read every label carefully. Look at the active ingredients rather than the brand name. You may discover that 2 different products contain similar ingredients without you ever realizing it. That kind of accidental duplication happens far more often than most people expect. Now ask yourself a very simple question for every single bottle. Why am I still taking this? If your answer is, I'm not really sure, or I've been taking it for years, or I just kept buying another bottle, then that medication deserves another conversation with your healthcare provider. Not because it's necessarily harmful, but because every long-term treatment should still have a clear purpose. Then ask yourself a second question. Who knows that I'm taking this? Many patients assume their physician already has a complete list. Unfortunately, that isn't always true. Perhaps your cardiologist prescribed one medication, your family doctor prescribed another, a specialist added something else. Meanwhile, you started taking 2 supplements after seeing an advertisement online. Each decision may have made sense individually. But unless someone sees the complete picture, important interactions can easily be missed. That's why I encourage every patient to carry an updated medication list. Include prescription medicines. Include over-the-counter products. Include vitamins. Include herbal supplements. Include everything. Bring that list to every appointment. It may be one of the most valuable pieces of information your healthcare provider receives that day. Finally, remember these 3 questions. Do I still need this medication? Am I taking the lowest effective dose? What should be monitored while I'm taking it? Those three questions can improve the quality of almost any medication review. Today's countdown included 6 categories that deserve extra attention after the age of 60. Decongestants, anti-inflammatory pain relievers, long-term acid-reducing medications, corticosteroids, testosterone therapy, and stimulants found in medicines, supplements, and energy products. Notice that none of those categories came with a single universal rule. I never told you to throw them away. I never told you that everyone should stop taking them, because responsible medicine simply doesn't work that way. The right medication for one patient may be completely inappropriate for another. Your medical history matters, your current health matters, your laboratory results matter, and the conversations you have with your healthcare team matter just as much. If there's one message I hope you remember after watching today's video, it's this. Never assume that a medication is completely safe simply because you've been taking it for years, and never assume that a medication is dangerous simply because you heard something alarming online. Ask questions, stay curious, review your medications regularly, and make healthcare decisions based on qualified medical advice, not fear. Thank you for spending this time with me today. If you found this video helpful, I'd love to hear from you. Leave a comment below and tell me which of today's 6 categories surprised you the most. Your experience may encourage someone else to ask an important question at their next doctor's appointment. And if you'd like to learn more about protecting your heart, improving your circulation, and making safer medication decisions as you get older, be sure to subscribe so you don't miss our upcoming videos. Until next time, I'm Dr. James Carter. Take care of yourself, stay informed, and remember that the healthiest decisions are almost always the ones made with knowledge rather than assumptions.